Have you heard about the white lung pneumonia and are you worried about it? This term has been making the rounds recently, causing a stir due to its ominous name and the reported outbreaks. But what if I told you that the name might be more misleading than informative? That's right. The term white lung pneumonia doesn't describe a specific illness or pathogen and doesn't give us any useful information about the severity or cause of the pneumonia. In fact, the recent outbreaks in northern China and Warren County, Ohio, are part of the typical cold and flu season, caused by common pathogens. Our aim today is to dispel the myths surrounding this so-called white lung pneumonia, backed by expert opinions and medical facts. So before you let that anxiety set in, let's dive deeper into this topic. Stay tuned to learn why experts are saying that there's nothing to be alarmed about. Let's start by understanding what white lung pneumonia actually is. You may have heard this term being thrown around in recent times, particularly in relation to recent outbreaks in northern China and Warren County, Ohio. However, it's important to clarify that white lung pneumonia is not a specific illness or pathogen. In fact, the term is somewhat misleading and not medically accurate. It's a phrase that's been used in some media reports and online forums to describe cases of pneumonia that have been particularly prevalent during typical cold and flu seasons. These cases are caused by common pathogens, organisms that can cause diseases. These include Mycoplasma pneumonia, adenovirus, and the flu virus itself. Now you might be wondering, what is pneumonia? Pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus, causing cough with phlegm or pus, fever, chills, and difficulty breathing. A variety of organisms, including bacteria, viruses, and fungi, can cause pneumonia. In the context of the term white lung pneumonia, it doesn't refer to a new or unique disease. It's simply a part of our regular cold and flu seasons, and it's caused by pathogens that we're unfortunately all too familiar with. So, let's not be misled by the terminology. While it's true that there have been outbreaks of pneumonia, it's not an unfamiliar foe we're dealing with. In fact, most cases of pneumonia are mild and can be managed at home without the need for hospitalization or antibiotics. Of course, it's always important to seek medical attention if symptoms worsen or if there are signs of dehydration. So, it's not a new or unique disease, but rather a part of our regular cold and flu seasons. The key to dealing with it effectively, as with any illness, is understanding it correctly. Now that we know what it is, you might be wondering, how serious is it? Well, let's dive into that. Despite the seemingly alarming name white lung pneumonia, it's important to understand that most cases are generally mild. Mild in this context means that with the appropriate care and attention, individuals can recover from this condition at home. There's often no need for hospitalization or antibiotics. However, it's crucial to remember that this doesn't mean the condition should be taken lightly. Pneumonia, regardless of its type, is still a disease that needs to be addressed. It can become severe if not treated properly. You might be wondering how to determine if the condition is worsening. Look out for signs such as persistent fever, difficulty breathing, chest pain, or signs of dehydration like dry mouth, increased thirst, decreased urination, or extreme tiredness. In such instances, it's critical to seek medical attention immediately. Doctors and healthcare professionals are equipped to manage and treat these symptoms effectively. They can provide guidance on the best course of action and help ensure that the disease does not escalate to a more severe stage. It's also important to remember that while this type of pneumonia can affect anyone, it's often young children who are most at risk. This is due to their developing immune systems, which may not be as robust in fighting off infections. Therefore, it's crucial to monitor children closely, ensuring they receive the right care and attention if they fall ill. In a nutshell, white lung pneumonia is a disease that demands respect and careful handling, but it's not the terrifying condition some media reports might lead you to believe. With the right care, most cases can be managed effectively at home, and full recovery is often the norm. While it's not to be taken lightly, it's certainly not as alarming as it's been made out to be. You might be asking, why then are there more cases of it recently? Well, let's delve into the factors contributing to the rise in pneumonia cases. It's not so much a matter of a new, terrifying disease, but rather an interplay of existing conditions and circumstances. Firstly, let's look at increased infection. Pneumonia, including the so-called white lung pneumonia, is most commonly caused by typical pathogens like Mycoplasma pneumonia, adenovirus, and the flu. These pathogens are part of our normal cold and flu seasons. They're nothing new, but they're certainly opportunistic, taking advantage of situations where they can spread easily. Now consider the environments where children spend most of their time: schools, playgrounds, and daycare centers. These are places where germs can spread rapidly among little ones who may not yet have fully developed their hygiene habits. Therefore, these environments can facilitate an increased rate of infection. Secondly, let's address decreased immunity or protection among young children. Children's immune systems are constantly developing and learning to fend off various pathogens. Sometimes they might not be fully equipped to handle these invaders, making them more susceptible to illnesses like pneumonia. Moreover, the protection we get from vaccines, particularly those for the flu, plays a crucial role in preventing pneumonia. However, if the vaccination rates drop, or if children miss their vaccination due to various reasons, it leaves them more exposed and vulnerable to these diseases. And then, there is the broader picture of overall health. Factors such as malnutrition, lack of access to healthcare, and pre-existing health conditions can weaken a child's immune system, making them more prone to catching pneumonia. So, when you put it all together, it's clear that the rise in pneumonia cases is more about these contributing factors and less about the disease itself. It's about our overall health, our environments, and how well we're able to protect ourselves and our children from these common pathogens. So the rise in cases is more about our overall health and less about the disease itself. Now let's discuss the most important part: prevention. Prevention is the cornerstone of our defense against illnesses, and this holds true for respiratory conditions, including the so-called white lung pneumonia. First and foremost, we must remember that our hands are often the unwitting carriers of germs. Therefore, washing our hands thoroughly and frequently is crucial. It's a simple act, but it can drastically reduce the risk of infection. Next, consider the mask, a simple barrier that can shield us and others from airborne pathogens. Wearing a mask, especially in crowded places or during flu season, can provide an additional layer of protection against respiratory illnesses. It's not just about protecting yourself, but also about contributing to the health of the community around you. Another vital preventive measure is staying home when feeling unwell. It might seem like a small sacrifice, but it can make a world of difference. By doing so, we limit the spread of germs to others, reducing the overall impact of the illness. In a world where we're always on the go, sometimes the best action is to simply rest and recover. Lastly, and perhaps most importantly, is the role of vaccination. Vaccines are one of the most effective ways to prevent diseases. They work by training our immune system to recognize and combat pathogens. By getting vaccinated, you're not just protecting yourself, but you're also helping to create a shield of immunity around those who can't get vaccinated, such as infants or those with compromised immune systems. In the end, all these measures are intertwined. They work together to create a robust defense against illnesses. Each action, no matter how small it may seem, contributes to the larger goal of maintaining our collective health. It's not just about avoiding white lung pneumonia, but about promoting overall health and well-being. Remember, prevention is always better than cure. As we wrap up, let's recap what we've learned today. White lung pneumonia, a term often seen in media reports and online forums, is not a distinct disease. Rather, it's a broad term often used to describe pneumonia outbreaks, like those we've seen recently in northern China and Warren County, Ohio. These outbreaks are part and parcel of the typical cold and flu seasons, caused by common pathogens like Mycoplasma pneumonia, adenovirus, and flu. The uptick in cases can be attributed to a combination of increased infection and decreased immunity or protection, particularly among young children. Remember, most cases of pneumonia are mild and manageable at home, without the need for hospitalization or antibiotics. But it's crucial to seek medical attention if symptoms worsen or signs of dehydration occur. Lastly, and perhaps most importantly, prevention measures such as regular hand washing, wearing masks, staying home when sick, and getting vaccinated are paramount in avoiding respiratory illnesses, including pneumonia. With accurate information and proactive prevention, there's no need to fear white lung pneumonia.